let's kind of give you guys a taste of this. So again, good evening, esteemed colleagues in integrative medicine. Today we're diving into the world of hormone testing, but with a twist. Imagine if hormone tests were on a dating app. So you'd have profiles full of charms, trends, and red flags, and those swipe right if moments. And then why this approach? Because in our field, choosing the right test is like finding the perfect match. It has to align with your patient's symptoms, lifestyle, and goals without the heartbreak of inaccurate results. But we'll swipe through the three contenders or bachelors via the hormonetestmatch.com app. So blood serum, we call it the reliable classic, saliva, the free-spirited adventurer, and 24-hour urine, the deep diving storyteller. So by the end, you'll have practical tools to integrate this into your practice. So let's keep it professional, evidence-based, and yes, a bit humorous because who doesn't need a laugh amid cortisol spikes and estrogen pathways? So first guy up who's been around the block. So this is our guy. So meet blood serum, the old school type of guy. So age, of course, classic status. He's the most popular. His bio reads, "Hey there, I'm the traditional, reliable type. I've been around the longest, and doctors love me. I show you everything, both bound and unbound hormones. So think of me as a person who shows up with the whole party." So what am I great at? Well, I'm great at, of course, humor aside, look at his profile here. Serum testing is the gold standard for a reason. It's the most researched and standardized method, backed by decades of clinical data, like that guy with a stable job in a 401k. It measures total hormones, free plus bound to protein like SHBG, making it real or ideal for baseline assessments. For integrative docs like us, it's perfect for monitoring bioidentical HRT. So he's like stuck in his 6X and picky, only recognizing bioidentical hormones and not synthetic due to its similarity to the natural hormone structure, and especially injectables or pellets. Though it's a tad iffy with transdermal creams due to the variable absorption. And you would notice here comprehensive thyroid panels, TSH, T4, T3, insulin resistance markers, pituitary hormones like FSH, LH, and prolactin plus androstenedione, IGF, and SHBG. And the cherry on top, insurance usually covers it. Because who doesn't love a date that picks up the tab? Red flags, but every profile does have one, and serum can't monitor non-bioidentical BHRT. Well, misses topical cream dynamics and ignores the metabolism of diurnal rhythms like cortisol's morning surge. Can't handle diurnal patterns, so no sunrise sunset romance for this guy. So plus the venipuncture, it can spike cortisol levels mid-draw, turning your calm patient into a stress case. Studies from the Endocrine Society highlight this pre-analytical variability. So again, swipe right if you're doing a full hormone baseline thyroid workup, detecting ovarian decline, or checking insulin resistance. Or if your patient's insurance is paying and they appreciate stability, much like a doctor-approved match. So clinically in my practice, I use the serum for initial evaluations in perimenopausal women paired with symptoms for a holistic view on to our basically next bachelor if you don't like this one. So now for someone a little bit more liberated, so this is our free-spirited saliva. So the free spirit, age, modern status, I'm always free and available. So the bio here, hey, there, I'm saliva, no needles, no drama. I'm all about what's active and available. Let's keep it real, unbound, and lipophilic. What's great about me? So there's one point for patients who hate blood draws. They can go for this for sure. And think at home kits that you can actually do. Painless and convenient. So collect me at home, then easy peasy, no needles. And saliva measures bioavailable hormones only. So he's all about the free, active life, no bound baggage. So the free fraction that tissues actually use correlating beautifully with the symptoms. Studies show it correlates with symptoms better than serum sometimes. So I'm more empathetic. So he's basically more in the feeling side. So it's stellar for multiple samplings, also like tracking the urinal cortisol patterns or menstrual cycles, perfect for tracking your hormone roller coaster over the day, like cortisol's diurnal drama. And also, it reflects transdermal bioidentical hormone replacement therapy creams accurately. And research from the Journal of Clinical Endocrinology and Metabolism shows strong symptom correlation. And it's also easy collection for cortisol awakening response or the CAR, or late night screenings for Cushing's. So I'm great for late night activities. Nothing naughty though, but I'm just good at checking cortisol checks for Cushing's and melatonin levels. And also no venipuncture stress, perfect for our stress sensitive patients in integrative care. My red flags would be I don't like anyone who doesn't care for their oral health. So it's not ideal for androgens if there's gingivitis, meaning testosterone, and also DHEA, which could actually show as falsely elevated if you have inflamed gums. So no solid reference ranges for cycling women and transdermal progesterone, which is a disadvantage. And it also skips hormone metabolism entirely. So don't ask me about metabolism. I'm surface level or just superficial overall. And also lingering cream residues can skew results. And it's not for long-term HRT monitoring. It might show too much from topicals. And if you're on creams and change doses, I might still be hung up on the X levels, thus altering your results. So swipe right if you're tracking rhythms, evaluating ovulation, monitoring transdermal HRT, or dealing with needle phobes. It's like that adventurous partner who keeps things exciting but avoids commitment. In practice, I recommend saliva for adrenal fatigue workups or PCOS cycle tracking, and combined with lifestyle interventions for that integrative edge. And that's usually kind of like I like saliva. I use that a lot. But of course, there are other ones that you need to see also. So on to our last bachelor. So finally, the one who spills all the beans on a date. So detailed storytellers, we call him. So last but not the least, 24-hour urine, the detailed storyteller, age, sophisticated status, the deep dive. So bio, I'm the analytical one who tells you the whole story, not just what hormones you have, but how your body is processing them. I measure metabolites and show enzyme activity. Think of me as the person who doesn't just tell you what they had for dinner, but describes every course, ambiance, and even the molecular gastronomy. What am I great at? This method provides a comprehensive metabolic overview, estrogen pathways for cancer risk assessment, anabolic catabolic balance, and stereogenic enzyme activity. It's also excellent for monitoring oral HRT due to the first pass liver effect, meaning oral HRT, I can handle that because the first pass, of course, that's definitely what we can see on the, I think it's the branching of that result in a specific test that we always use. And also integrated 24-hour urine output via GCMS makes a full steroid spectrum. So bonus here, it evaluates growth hormone output reliably. For those dreading the jug, dried urine strips, which is my little brother, offers a less burdensome alternative. So it also reveals detoxification capacity and enzyme issues, crucial for personalized integrated plans, like optimizing estrogen detox in breast cancer prevention. My red flags would be I'm inaccurate when kidney issues or when there's hematuria ongoing. It also averages out diurnal patterns, no peaks or valleys, just a summary, and also less precise for circulating precursors. So it's all about the metabolites. And that 24-hour collection, it's a commitment. Patients might bail halfway. So collection, imagine that hauling a jug around. So talk about the baggage that I carry. So poor, meaning also it's also poor for using as baseline levels and also for androgen monitoring. So swipe right if you're assessing estrogen metabolism, cancer risk, or oral HRT, anabolic catabolic balance, or enzyme activity. Or for 24-hour growth hormone evaluation, if you crave complexity and metabolic insights, this is your soulmate. So just prep for a long, chatty date. So clinically, I use urine for patients with hormone-related cancers or detox concerns. Integrate with nutrigenomics for tailored protocols. So dating reality check. So as you can see here, sometimes really blood serum is your steady baseline buddy, reliable, insured, but misses the nuances. Saliva is the chill, bioavailable option for patterns and convenience. There's no needles. Urine dives deep into metabolism for those intricate cases. But in integrative medicine, really the perfect match depends on the patient's symptoms, compliance, and goals for holistic care. So remember, no test is infallible. Correlate with history and follow-ups. So some couples thrive in contrast. Sometimes you need a polyamorous lab strategy, so you mix and match. The dream team combo is what I suggest in terms of approach. So serum for baseline hormones, saliva for active cortisol and initial monitoring, and urine for estrogen metabolism. So together, it gives you the full 3D picture, like looking at your partner's LinkedIn, Instagram, and therapy notes all at once. So thanks for swiping along. So that's our hormone presentation in terms of testing.
Okay.
All
So,
right.
yeah, let's see if there's anybody. Dr. Porter, I began HRT vaginal DHEA suppositories for the past 6 weeks. What a revelation in the youthful results. Yeah, so DHEA, converts into testosterone, and testosterone will increase lubrication and thicken vaginal tissue. So good analogies there, Dr. Nario. This is an A4M, so we don't have to go pay for this.
No, it's a freebie for everyone.
Okay. So there's some clinics they'll only do saliva. They'll tell you that the serum is no good for anything, and some will only do the urine tests. And the one advantage for the serum, I think, is that the insurances will pay for some of it or most of it. How about saliva and urine? Do they pay for any of those?
I think saliva is starting to, there's a company out there. I think you have to sign some forms, but I'm hearing that that company is starting to pay for it also through insurance. But urine for sure, no. So maybe saliva is your best bet if you don't have insurance.
So what does a saliva test go for if I want to do a hormone panel?
Around, I think $200 to $300 depends on what you want in there. But my patients kind of spend like the 300 because they want the whole E2, E3, and also progesterone, cortisol, even the 3-point cortisol. I think 4-point even you can do it. So it's not cheap. That's why you can't do it all the time. It's just that again, the concept of salivary testing is the hormones that we use, especially topical, goes into the acinar cells of the salivary glands. So that's why it concentrates there. And that's why when I mentioned about the lecture, that when you're using a lot of hormones already, it starts to accumulate. And of course, absorption is so different that it can be skewed after using salivary testing for a long period of time. It's good as an initial testing, maybe a few months in, but really it's not your go-to when you're in a chronic phase of using hormones already.
And then some will only use the urine test, right?
And that too, that's not right. That's the thing. You're just seeing metabolites. You're not really seeing the real levels. I've seen practitioners adjust their dosing in relation to metabolites, but when you test it from saliva and also urinary, it's not matching. But you really have to coincide. I think symptoms really is your best bet. If you don't have that money to spend that much, use blood and also your symptoms. I think you won't go wrong with that.
The problem with the blood, especially if they're on some, like testosterone therapies, especially women pellets, you're going to get blood levels of 100, 200, 300, but that's not really what's at the tissues. But they go to their, doctor who doesn't, who's looking at the ranges, and they have a conniption when they see this. Right. I mean, I don't know. I've been doing hormone pellets since 2003. So somebody comes, if we get a serum blood level of 102 on a testosterone level, 30 to 40 is sort of our ideal, by the way, if you don't know off the top of your head. I don't panic. We go by symptoms.
What's the black box warning that you have to probably be worried about? But again, they're not thinking that it's bioidentical. So you have to remember, when you're using serum, you always find the natural hormones in there. So when you're using bioidentical, it's proper to use it's proper to use serum. But if you're using synthetics, progestins, progesterone, those are synthetic and they're not going to show up most of the time in your serum.
If you were my student and you're using synthetic hormones, you fail. So that's
Well,
I'd rather they don't use anything than use those.